So, hi everyone, hope you are doing very well. So, we are going to discuss about acromegaly. Acromegaly in cat, you see there in picture, there is a large head and also there is large paws of cat. These are the basic, you can say, signs of acromegaly, or the other name of acromegaly is hypersomatotropism. So let's have a detailed discussion on acromegaly. If we say that definition, excess endogenous growth hormone, we generally say that there is a hypersomatotropism level, but when we going to discuss a broad term, then we say that there is a high level of growth hormone in blood. So the other names of the acromegaly is hypersomatotropism. Okay, then if we say that it is most common in older cats, this is the best thing about acromegaly, or rememberable thing about acromegaly. This is found in older age, like 10 years or 2 to 70 years, and it is dominant in male. If we say about genetics, breed, predisposition, so main cat or main coon cats are overrepresented these acromegaly signs and symptoms. So risk factors about acromegaly is progestin administration, or if the cat is unspayed female cat, or having an affected sibling. So these are the risk factors of the acromegaly. Then discuss about the clinical presentation. Clinical presentation, we find adenoma of the somatotrophs of the pituitary glands. Clinical signs you can see, or you can judge from the radiographic or imaging. You see adenoma of the somatotrophs of the pituitary gland. And in dogs, the most common thing which you find that progestin induce growth hormone production and secretion by the mammary gland. So this is a basic difference in cats and dogs. In cats you find adenoma, while in dogs adenoma is not common. In dogs, progestin induced growth hormone is most common. So what is the chief complaint or history? You find polyuria, polydipsia, polyphagia. Okay, these are also signs of diabetes mellitus. We will discuss in the topic of the diabetes mellitus. Weight gain with poor or good or poor diabetic control. So weight gain is also the sign of the diabetes mellitus in some case. We will discuss detail about diabetes mellitus with increase or decrease weight. This is other thing. So basic three signs are also the signs of the diabetes mellitus. Then we are going to about dogs. Clinical sign typically begin 3 to 5 weeks after estrus in non-pregnant bitches. Owner should be questions about the period administration of the synthetic progestin. Whenever there is a synthetic progestin for the estrus induction, then there can be a chance or risk factor to induce acromegaly. Then in non-diabetic cats can be present with myocardial thickening, heart failure, signs due to upper airway thickening. These are the also signs found in the acromegaly, because you find hepatomegaly, splenomegaly, cardiomegaly, because it is a simple terms of acromegaly, but when we discuss in detail, then we find acromegaly, splenomegaly, hepatomegaly, cardiomegaly. So heart failure, upper respiratory signs, these are the signs are common in the acromegaly. Physical exam finding, you find broad facial feature, big paws, diffuse thick earning. If you want to see there, this is broad face, broad face, broad paw, big paws. Got it? So this is basic clinical sign or physical examination finding of acromegaly. Then you find protrusion of the mandible, organomegaly like hepatomegaly, rhinomegaly, splenomegaly. Okay, so if we are going about etiology or pathophysiology in cats and less common in dogs, excess growth hormone secretion is due to tumor, usually adenoma of the pars distalis of the anterior pituitary. You find in dog disease stems from progesterone induced growth hormone secretion by mammary tissue. Okay, so there is a both difference the pathophysiology of cats and dogs. Acromegaly in cats you find excess GH due to tumor like adenoma. We have discussed these things in start. So clinical presentation, in cats you find adenoma, in dogs you find GH production by the mammary glands. Okay, so next thing is chronic growth hormone excess has catabolic and anabolic effect. This is the important terms or important thing in the acromegaly. Growth hormone results in the elevation of the liver insulin like growth factor IGF-1. This factor or this uh, uh, growth factor you find in the diagnosis. In serum level you find IGF which diagnose the acromegaly. And then if you are going about the catabolic, because chronic growth hormone shows both catabolic and anabolic effect. In catabolic effect you find catabolism in which major thing breaks down to smaller things, or major compound breaks down into minor compounds so that it is used by the muscles or organs. Catabolic effect in which gluconeogenesis take place, and there is a lipolysis, production of the lipids, and then diabetes mellitus usually results. Okay, so acromegaly results in the diabetes mellitus because catabolic effect take place, gluconeogenesis happen, and there is a hyperglycemia which results in the diabetes mellitus. If we see about the anabolic effect in which smaller objects or smaller compounds combine to form a major thing, it is called anabolic effect, in which the IGF-1 is produced, okay, from the cartilage, soft tissue or viscera, from the proliferation of the bone, cartilage, soft tissue or viscera. Okay, so IGF is most important term in acromegaly diagnosis. Diagnostic serum IGF measurement is an effective screening tool in cats and dogs. If you identify IGF level, increased level of IGF, then you can say this is acromegaly and it is found in older cats. Given the high prevalence of acromegaly, if IGF is above the reference, it is 90% certain the disease is present. Differential diagnosis, you diagnose from hyperadenocortism, drugs, diabetes mellitus, obesity, other things. Confirmatory testing is CT scan or MRI of the pituitary gland to see there is adenoma or some like tumor present in the pituitary gland, which confirms the acromegaly or the production of growth hormone. Treatment includes the removing the cause. So in dogs we remove or cessation of the progesterone administration or neutering. In cats we remove the we go for pituitary tumor removal or inhibition of the tumor GH secretion. Acute general treatment, diabetic pests require treatment for the diabetes. Okay, so in dogs we usually go with aglipristone, a progesterone receptor blocker. This will reduce the diabetes mellitus chances, or it's a good drug for the DM treatment. So next thing is chronic treatment. If we go for chronic treatment, best results seen with the hypophysectomy. If we go with hypophysectomy, if there is a high level of acromegaly or a chronic stage of acromegaly, then we go for surgery and we remove the tumor from the pituitary gland, which is hypophysectomy. Then there is a cats sponsoring the cheaper alternative, cabergoline. There is another drug which we use, cabergoline drug is used for, which is cheaper and used in market. Radiotherapy is also used to treat acromegaly, which shrink the pituitary tumor and improve diabetic control. The other thing, possible complications, if treated with the high insulin doses, there is chances of hypoglycemia can occur. Okay, So this thing is also keep in mind whenever you're going to treat acromegaly. There is a risk factor or chances of hypoglycemia. Whenever there is hypoglycemia, you find nervous signs like seizures. So with hypophysectomy, hypocortisolemia and hypothyroidism may also occur. Good. So this is all about acromegaly. Hope you will find some knowledge from this topic. See you soon in next video, in next topic. Have a good day.